Hello students. In the last lecture, I discussed about what is biomedical instrumentation, what is biomedical engineering, what is the role of instruments in the medical field, how it has impacted the human life. I hope in the last through the last lecture, you might have understood what is the necessity of this subject, why we are studying this subject, what is the importance of this biomedical instrumentation. So now in this lecture I'll be discussing about the landmark developments in biomedical instrumentation, and then I'll be discussing about the classification of biomedical instrumentation. So let's discuss about the landmark developments. So there are numerous instances about the development of different devices, equipments, and techniques which are helping the healthcare professional in the efficient discharge of their duties. So here there are in this slide you can see few of the important landmarks in the history of development of various medical equipment. So starting with let's see, in 1816 stethoscope was invented, and then in 1851 ophthalmoscope was invented. Then in 1895 use of x-rays in medical imaging. In 1896 sphygmomanometer was used. Then in 1901 first electrocardiograph machine was invented. Then in 1924 first human electroencephalogram was performed. Then in 1927 first practical modern respirator was invented. Then in 1943 first electron linear accelerator designed for radiation therapy developed. In 1945 first practical human hemodialysis machine developed. And in this way these are the years given, and along with the years here the invention of the landmark developments, or you can say the landmark developments in biomedical instrumentation is mentioned. So now moving ahead to the classification of biomedical instrumentation. So this biomedical instrumentation can generally be classified into two major categories, that is clinical instrumentation and research instrumentation. This clinical instrumentation is basically devoted to the diagnosis, care and treatment of patients, whereas research instrumentation is used primarily in the search for new knowledge pertaining to the various systems that compose the human organism, or you can say it is this research instrumentation is for research in human organism. Although some instruments are there which can be used in both areas, that is the clinical instruments are generally that is there are some instruments which can be used in both clinical part also, whereas in research part also. But however, clinical instruments, they are generally designed to be more rugged and easier to use. On the other hand, research instrumentation is normally more complex, more specialized, and often designed to provide a much high degree of accuracy, resolution, etc. And moreover, these clinical instruments are used by the physicians or nurse, whereas research instruments are generally operated by skilled technologists whose primary training is in the operation of such instruments. So this was the difference between clinical and research instrument. Now moving ahead, now since biomedical instruments, as I've told you, this was the very broad classification, like biomedical instruments were classified in clinical instrumentation and research instrumentation. Biomedical instruments can also be classified as diagnostic and therapeutic. I've already mentioned what is diagnostic and therapeutic in my first lecture. That is, diagnostic instruments are those which are used to detect any disease, whereas therapeutic instruments are used to cure that disease. But apart from this major categorization, there are several other ways to classify the biomedical instruments, and these are the categories listed here, that is direct or indirect, invasive or non-invasive, contact or remote, sensor or actuator, static or real time. Now, what is direct or indirect measurement? And instrument is said to be a direct, means we are classifying the biomedical instruments. The first classification is among direct or indirect instruments. So direct instruments are those instruments where the sensing system measures the physiological parameter directly. For example, blood pressure in an artery. For measuring the blood pressure in an artery, that instrument is will be called the direct instrument, because it measures the blood pressure of the artery directly. On the other hand, indirect instruments are those which measures a parameter which is related to the physiological parameter of interest. For example, ECG recording at the body surface, it is related to the propagation of action potentials. What I am trying to say, that whenever you whenever you get a ECG recording, that ECG recording at the body surface, it is related to the propagation of electric signals in the heart, but it's not a direct measurement of the propagation waveform. So you will study more about this ECG. You might find this sentences little bit confusing because you do not know about ECG. So I'll be discussing this when I'll be discussing the cardiovascular system and the measurement techniques. There you will study more clearly about ECG recording and what does it represent. So this was the first classification, indirect, where the sensor system, where the instrument is directly measuring the physiological parameter, and indirect, where the instrument is measuring a parameter which is related to the physiological parameter. That is, in indirect measurement, it does not directly measures the physiological parameter of interest. Next classification is invasive or non-invasive. So in case the measuring instrument needs to be implanted in the human body, either by piercing the skin, catheterization, or surgery, then it is said to be an invasive instrument. So what is invasive instrument? When an instrument, it needs to be implanted in the human body through surgery, then it is an invasive instrument. For example, direct electrical recording of the action potential in nerve fibers through an implantable electrode system. Here what we are doing, we are implanting an electrode system in the human body for measuring the for direct electrical recording of the action potential in the nerve fiber. So this will come under invasive. Whereas what is non-invasive? For example, an imaging system which measures blood flow dynamics in an artery using ultrasound color flow imaging is an example of non-invasive. So non-invasive procedure is defined as that medical procedure which does not break the skin. So the example that I've just given you, it is through ultrasound measurement. Next category is contact or remote. So contact types of instrument actually come in physical contact with the measurement. As you can see here, the contact type of instruments, they actually come in physical contact with the measurement. For example, a strain gauge sensor attached to the muscle fibers to record deformations and forces in the muscle. And contrary to that, remote instrument, for example, in remote instrument you can have MRI or ultrasound imaging system. So these systems, they can measure internal deformations and forces without actually contacting the tissue. It is not actually contacting the tissue. It is through a remote, it is at a remote distance. So this MRI and ultrasound imaging is an example of this remote instrument. Next classification is sensor or actuator. So a sensor detects biochemical, bioelectrical, or biophysical parameters. So what is the role of sensor? It actually detects the biochemical, bioelectrical, or biophysical parameters of the body. And whereas what is actuator? What is the role of actuator? An actuator delivers external agents through direct or indirect contact and controls the biochemical, bioelectrical, or biophysical parameter. And if I have to give an example, then an automated insulin delivery pump is an example of direct contact actuator, whereas this high non-invasive surgery with high intensity focused ultrasound, it is an example of remote non-invasive actuator. So this was basically the example that I've given of contact or remote types. Now next classification is static or real time. The last classification is static or real time. So static instruments, they measure the time averages of physiological parameters. The measurement is slower than the rate at which parameter is changing, and so it cannot follow it in real time. So that's why static instruments, they measure the time average of the physiological parameter. Thus it can only and that average value, that is over a period of time. And real time instruments, they actually have a time response faster than or equal to the physiological time constants of the sensed parameters. The example of this is an ultrasound Doppler system, which can measure changes in arterial blood velocity over a cardiac cycle. This is the example of a real-time instrument. So this was all about the classification of biomedical instruments. Now next, coming to the measurement. Now the measurements in which biomedical instrumentation is used, it can be divided into two categories. They are in vivo and in vitro. So an in vivo measurement is one that is made on or within the living organism itself. An example would be a device inserted into the bloodstream to measure the pH of a blood directly. So an in vitro, whereas an in vitro measurement is one which is performed outside the body, even though it relates to the functions of the body. An example of in vitro measurement would be the measurement of pH of a sample of blood that has been drawn from a patient. So literally this in vitro means in glass. Thus in vitro measurements are usually performed in test tube. So again I am repeating what is in vivo and what is in vitro. In vitro measurements are those measurements that are made on or within the living organism, that, for example, by inserting an instrument into the bloodstream to measure a parameter, whereas in vitro instrument or in vitro measurement is that measurement in which the measurement is carried outside the human body, and that is the measurement is carried outside, for example, taking the blood sample from the human body and performing the measurement using a test tube. So in vitro means test tube or related to glass measurements. So this was all about the classification of biomedical instrumentation, and I'm ending this lecture here. I will be continuing with the same topic in my next lecture. Thank you.